So Ali, man, you not believe what happened to me today. Like, man, my family and I just went through a crazy day. Like, this is like I was even sure that I was going to tell this story as one of my, you know, one of the diary sessions. But
Mhm.
honestly, man, you know, when you're afraid of something, you don't want to see it happen again.
Yeah.
Something similar had happened in the past. I know. I think we've made the content, or I'll probably share that story again, or I'll share it again. But honestly, you know what? This morning I was out early, as usual to get going, get my gigs going, trying to make some money. I'm still trying to settle. I've been here a few months, few weeks, if you say, but
Yeah.
calendar, you say maybe a month, a few months. So, you know, so I was out early, and I think like what 7:20, my wife calls me and says, our daughter woke up crying and cannot open her eyes. Like, so when she said it on the phone, I was like, okay. So, I
Cannot open
mean,
our eyes.
like, she cannot open her eyes. You know my history. You know what we went through with our son
Yes.
back in Nigeria,
Yes.
right? So
Yes.
that first shock, like, okay. So I was driving, so I kind of just, took a breather, and I felt like, okay. Um, so like, what do you mean? The good thing was she didn't sound panicky on the phone, so that was good. So I was
Mhm.
like, okay, so what do you mean? She was like, oh, she woke up, you know, and she woke up crying. And when she got to her, you know, our little 3-year-old, princess just wouldn't open her eyes. I was like, okay, so backtrack the day before, which was yesterday rather.
Yeah.
I'd taken her and my son out for a ride, and also to go make her hair. So, I mean, it was a very difficult one because usually we invite the person over to make our hair at our place because we're family friends.
Yeah.
But this time we went over also because I wanted my son to hang out with his friends, which are the children of this family friends.
Yeah.
During the process, my 3-year-old, she cried a lot. Like she cried, she like it was a very painful experience. I don't know why she cried so much during the process of making her. You know how kids, yeah, can be. So I just thought, you know what, maybe that was it, and maybe the whole thing, maybe So I told my wife when she told me on the phone, I said, okay, um, okay, I was already on my way. I was already like 30 minutes drive away from the house, so I was like,
Yeah.
okay. Um, I'll wrap up what I'm handling at the time, and I'll start heading back. So I'll call you shortly. But then in my heart, I just started praying because, you know, it was like a deja vu, right?
Yeah.
So, but this time that was what it felt like a deja vu. I'm reliving, that fear, you
Yeah.
know. So, but guess what came with that? While I was rocking all sorts in my head, praying,
Yeah.
not freaking out driving, I turned, I made my way back home. And it was, it was morning, it was in the morning, it was that early, it was like 7:20. On my way back, there was a lot of traffic, morning rush,
Yeah.
to work. But it wasn't like really bad, like compared to growing up in Lagos.
Yeah.
So I think in like 20, 25 minutes, I think 25 minutes, I was home, go home like just 8:05.
Yeah.
But I found my wife on the phone, you know, talking to the hospital. Because the craziest thing, our insurance was cancelled for some weird reasons. Weird reason, our insurance was cancelled. So she was calling the hospital to let them know that we're going to be on our way. This is
Yes.
situation, and
Yes.
we were checking informations and all that, and they were like, "Oh, our insurance was like, there's something about the insurance, like it's not active. That's the word, not cancelled, rather.
Was deactivated.
It was deactivated." And guess what? It's been deactivated since 2021.
What?
Since 2021, my daughter had not been to the hospital. She had not fallen
Yeah.
sick. go to the hospital for anything.
Yeah, yeah.
I don't know why. But my wife's insurance was active. So, I got in, carried my daughter, started petting. I started trying to find out what's wrong. So, I was looking at her. I was worried sick. I was just praying. I was like, God, please, please. Like, I just kept praying because that was all I could do in my, there and then. But, I was trying to pacify her and just talk to her and, just to see, try to get a feel of what's really happening. Like, is this something serious? And what's this all about? Man, but she wouldn't stop, screaming, it's hurting, it's paining me, and she wouldn't even open her eyes, So, my wife was like, man, this, what's gonna, what are we gonna do? This is like, we need to. She needs to call the insurance company. They need to get, the insurance active before we get to the hospital. Otherwise, we might have to pay out of pocket. I was like, pay out of pocket? You think paying out of pocket is not the issue right now? Like, let's get going. So immediately left, got in our car. I was just headed to, straight to the hospital, and she called, and that was also the hospital where my wife gave birth to her. So, they have a history. I mean, there was never any issue with her. She's never had any complications. She full-time baby, everything. So boom, went to ER, got there, went inside, and boom, they listened, they took our vitals, took her in, quickly. There was a nurse somewhere was attending to us. It was pretty quick, trying to see what they can do. One of the doctors came quickly and tried to. So this was a challenge. She wasn't opening her eyes. Her eyes were shut. So without looking at the eyes, there's no diagnosis that can be made. There's nothing they can do. So that was part of the challenge. So they recommended one eye drop. I think it was supposed to numb the pain. Right?
Yeah.
So struggled, managed to. All this time, she's like, all this time she's wailing and crying, like all this time. Wow. So they got the eye drop, applied it. It wasn't an easy process, but they did successfully apply the eye drop, and it numbed the pain.
Yeah.
Now it was supposed to numb the pain for a significant amount of time, but guess what? They were barely able to just look at the cornea for her to shut the eyes all over again. And so, they were like, they can't get enough reading from that, She's a 3-year-old. So they had to refer us, they referred her to an ophthalmologist in-house, right?
Yeah.
But the ophthalmologist was a very massive, hospital. So the ophthalmologist was in another building, and hence they was in clinic, and so they wanted us to come to the clinic.
Yeah.
So someone came. Now, this is one thing that I experienced my first time in the hospital in America, right? That I don't know who the person is. She came with a wheelchair, and I was like, wheelchair? You're like, okay, wheelchair. Why are you wheeling the wheel? And she was like, oh, because I was holding my daughter, right?
Yeah.
I'll have a seat. I'm like, okay. I sat in the wheelchair, and they started wheeling me around, wheeling me in the hospital to the next place.
Oh my God.
I was like, okay. My wife was just laughing at me, like.
So for you, you're thinking, I think I can walk.
I can walk. I've been to general hospitals in Nigeria. You get what I'm saying? Like,
yeah.
I mean, this is without due respect, right?
I'm gonna assume that they just have procedures for that. Like, for example, like you could be at risk of like tripping, for example, if you're walking. So once you're under their care, they have to make sure they avoid all sort of like accidents or anything that could happen. So I'm not going to guess that's the best reason. And for me, when I was I had an incident when I lived in Germany. Again, I had like I didn't this I still don't know what it is today, but I had some issues with my heart, and I was pretty much wheeled around the hospital all my time there. If I had to go and take a test, if I had to go to the lab, I went to like a few labs. First, I was in the emergency ward for pretty much throughout the day. Then I was admitted, and I ran a few tests. While I was being wheeled around, I felt like I could walk on my own. Yes, had a pain in my chest, but like for me, that's the procedure. Like they have to make sure they take you to to different points, like safely and accident free as much as possible. So that's for you. I think that will also make sense if I was the provider, because again, like if for a hospital, you don't want a situation where you didn't do everything to avoid any kind of issues.
So I mean that's understood by me, but it was just something really.
It's different, definitely
because it was the first time. It was first time experiencing. It was first time being to the hospital in the US, right? But so I mean, we went to the other part, to the ophthalmologist. Whether it beat, the ophthalmologist came, took us into one of the I think rooms. The same challenge. She was opening her eyes. They couldn't really, do anything. So they called another doctor. Then another doctor. That other doctor called a more senior doctor. Everybody just kept, trying to get her to open her eyes, because they didn't want to administer another dose of the numbing eye drop, right? Because just like I earlier mentioned, I think it might impact whatever readings they're trying to get. I think the most experienced doctor that came was able to cajole my daughter to try to open her eyes, and even though she didn't, with just a little bit of support, was able to look at it and say, you know what, we had two options. One was for them to do what you call, which was what was done to my son back in Nigeria when he had when he had this eye issue. Examination under anesthesia. I think EUA or whatever. I think there's a short word for it. So they they'll put her to sleep to kind of do the examination. Or from what he had seen from the clinical examination, there was nothing he could see. So they recommended an antibiotic eye drop for us to apply for 24 to 48 hours. And if there are no improvement or she's getting worse, then we should bring her in. Then they would conduct that examination they'll put her to sleep.
Okay. Did they find out what could have been the cause, or did they give suggestions?
So I mean, after all of the information we gave, they assumed that he assumed that it is possible that she might have caught a cornea, but that those kind of injuries heal quickly.
Oh, okay.
That's why I was recommending that, just in case, just to avoid any infection.
Okay.
And because she made her hair the previous day, anything could have touched the eye, the cornea or anything. So because of that, he recommended that we should use the antibiotics, if I'm correct, to help prevent infection. And if there's no improvement, then we can bring her in for a follow-up. But then they scheduled today a 48 hours appointment for us to bring her in, just in case. For whatever happens, we should bring her in 2 days. Otherwise, we should bring her in immediately if there is no improvement.
Okay.
So kids being kids. My daughter still didn't open her eyes. She was still in pains. They brought the wheelchair again and rolled us back to ER, where they gave us the antibiotic, and finally discharged us. But before we left, we administered the eye drop, and my little 3-year-old said, "That's pretty fast." I feel better. So I was like, oh, everybody was like, okay, you feel better? He said, yeah, I feel better. Can you open your eyes? No. I was like explaining it to us. Come on, do you feel better? He said, yeah, I feel better. Can you open your eyes? Like, no. Kids, So we took her, went to the car, went back home, and our way back, we stopped at one of the place where one of the restaurants, one of the restaurants got donuts. She likes donuts, so we got her donuts. And we'll go home. So, before we left, so one of the things we noticed while we were at the hospital was that because of the condition, she was reacting to the ray of light. So whenever each time they did try to examine her, we would turn off the lights and just have some dim light.
Oh, okay.
So in that, those are the times that we were able to examine her. So we noticed that as soon as we came into our apartment, the house was pretty dark because all the curtains, all the blinds were closed before we left. As soon as we came in, my little princess sat on the chair, opened her eyes, and laughed. Oh my God!
And wait, that was it?
Are you okay? She's like, yeah. Do you feel better? She's like, yeah. we looked at her like, okay, like children. I'm like, okay, amen. Thank God. It's not this serious, right? Okay. For me, that's what it was. Like, okay, you're fine. Yeah. It's nothing out of the ordinary. We're not reliving that fear we have with your brother, right? Okay.
Yeah.
So for me, that was what it was, But I noticed, children being children, something was still there, right? Because she kept itching her eyes, but we tried to also administer the eye drop as I went due through the course of today, and we noticed improvement, even though I noticed she still kept, itching her eyes. So, kids being kids, something was really happening, because even after we came back, she ran to her mother, I think, like 4 hours later. She's feeling a bit uncomfortable, her eyes again, complaining a bit. And so I started, I think, the follow-up dose at that time, around that time. But up until this evening, I noticed she's much better. She's very stable. She's been playing with her brother. I mean, went to Walmart to get some stuff, and we got like a doll, a cat, I don't know what it is. One of those.
A toy.
Yeah, we got like a toy or something, and she just been playing with it all evening. So yeah, she's better now. I'm so excited. I'm happy because honestly, it scared me. It really scared me.
Yeah.
Even with our son. I know I shared that already. This is way, I know part of the joint, part of the the reason for our move. This is one of it. Like our son went through was one of the reasons we moved, among other things. Like there's a history. I know I should share the story as we progress. But honestly, what we went through with our son was one of the reasons, that cemented why we moved.
Yeah.
Moved to the US.
Yeah.
Seeing that same thing, whether it's a deja vu or whatever you call it, or just a similar event.
Yeah.
For whatever it is this morning, bro, I freaked out, man. Honestly, if you've ever been through very difficult times and you feel like you've gone past that and there's a glimpse of that happening all over again, it will freak you out.
Yeah.
So I'm just thankful that it was nothing like we went through with our son. It was
Yeah, I'm
just
happy. I'm so glad for your family too, that you that she's doing much better now. Hopefully, when you go back for the follow-up, like it's gonna be nothing.
yeah,
It's just gonna be that she hurt her eye or eyes, and I'm not even sure if it's both of them or one of them. Some way, somehow, like that's all there is to it. Is like
that's what I hope for. That's what I hope for. That's what I hope the follow-up will show us, that there's nothing, there are no pressure issues or anything
yeah,
like that. Yeah, so this is diary session for today about my almost
yeah,
scary day, man. Speaking of Bill, I mentioned earlier that the what's it called? The insurance for my daughter was inactive, right?
yeah.
Well, no one asked us about payment or anything when we go to the ER, right? It was all
Yeah.
about just taking care, care. It was all about care.
Yeah.
But on our way, the insurance company had confirmed to us that they were, because we are putting, we were already aware of the insurance being inactive a month ago, and we had followed up with all of the documentation that they requested. But because of the holiday, because of the Christmas celebration and all of the holidays in between, they require, I think, a length of time, 15 days or so, to process all of the document that we sent in and reactivate the account, right?
Oh, okay.
So what they confirmed to us, it was just 8 days in the process before this happened.
Oh, okay.
But the good news is they are informed us that they will backdate the active date even though it's inactive. So we're told that, of course, we'll get a bill.
Yeah.
We'll get a bill, but when the bill comes in, we should send it to the insurance and they'll take the bill.
Oh, okay. Oh, okay.
They'll backdate the active date. And for me, that's priceless in terms of just having access to care, right? Yeah. I just seem to have a lot of, I've just had a lot of difficulty in my life generally, as well as a lot of exciting, amazing experiences so far as a person.
Yeah.
And one thing that this experience really just proves to why access to healthcare is priceless is the fact that we're never asked to pay before care, right?
Exactly.
Which is where coming back home, it really, really hurts because, I've seen my family go through difficult times, through health challenges. And I've seen how, that can be a burden for many families back home, right?
Yeah.
Where people have to, gather to try to raise money, which is which is a constant thing.
Yeah.
For something like as this, that we're able to get care even though our insurance was inactive, and whatever the bill, we're not asked to pay before treatment, right?
Exactly. Like back home, like you have to pay. They will tell you to deposit something first.
Exactly. Yeah, that's what it is. Back home, if you have the insurance, I shared a story about our son about the experience. I did share a story. It was it was cash.
Yeah.
Right? It was cash to save him.
Yeah.
But for our daughter, this morning, it wasn't about cash. It was access. It was acting for us to take her to the hospital. It was all that was required from us as a parent, to take her to the hospital. It wasn't all about. It wasn't about, we need cash to pay and all that.
Yeah.
Okay. Now, thank God it wasn't anything serious. But hey, we can worry about the bills tomorrow. But today, life is saved. That's what's important.
Yeah, I'm happy, so happy for the news. It's good. It's good to have you back, and it's good for you to join us too, because I know that I can see it's like if you told me this is what happened, but you have want to focus on your family, I would understand. But I'm happy you're able to join us and just share your day with us. I'm also happy about the news that your baby is doing much more better. So we'll just end it right here, and We'll see you all next time.